What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are, and however you might be listening to me today. Thank you so much for taking the time. Folks, today is episode 263 of the Everything Medicare Podcast. Each and every week, my company brings you free Medicare information in the form of a podcast where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And today, folks, I'm going to answer and address a question that we get asked all the time, which is, will a plan really put money back into my Social Security check if I sign up for it? We've all seen the TV commercials. We've all seen the ads, right? Call today and get $150 a month back into your Social Security check. And I've dissected those commercials to no ends, right? On our YouTube channel, on this podcast a little bit, kind of talking about how they take the truth and stretch it. What usually those TV commercials are referencing is they're referencing one of two things every single time. Number one, they're referencing Medicaid. Usually on the screen it says you have to qualify for your state's Medicaid program to get your entire Medicare Part B premium, which at the time of recording this is $148.50 a month in 2021. Paid for, and Medicaid is done through your state government. So whichever state you live in, it's done through your state, and it's for people that are in dramatically low income brackets, right? It's assistance for people that can't afford the Medicare Part B premium. You have to be very low income to qualify for Medicaid. So it says that in the fine print of almost all these commercials, right? They're absolute liars and scam artists. Because they say, call today and we'll set you up with a plan that will do this for you. And then in the fine print it says, well, our plans won't really do this, but Medicaid will, which has nothing to do with which plan you enroll into. Or you'll find that there are certain Medicare Advantage plans that do a benefit that's known as a Medicare Part B give back. Now, what a Medicare Part B give back is they will do typically a portion of your Medicare Part B premium, and they'll reduce it by that amount. So if the Medicare Part B premium is $148.50 a month, and let's say they have a Medicare Part B give back of $50 on that particular Medicare Advantage plan, you cannot get this benefit through Medicare supplements, but Medicare Advantage. What will typically happen is, let's say it's $50 a month, then your Part B premium gets reduced to $98.50 a month instead. So that part of it is true. Are there any plans that will do the entire Medicare Part B premium? I've seen one plan in 3 or 4 counties in Florida, and that's it. And that particular plan has a very small provider doctor network, so it's not very popular anyway. There's hardly anywhere you can go to the doctor. I won't mention a company name or anything like that. And for the most part, in most areas, you'll find that a plan might do $20 a month back, $30 a month back, maybe $50 a month back. In some markets where it's really, really strong Medicare Advantage markets, they might do $100 a month back. So there certainly are areas that will do a lot back. But for the most part, in most states, it's usually going to be 20, 30, 40, 50. Now, it's very common that a lot of these markets, especially some of these rural markets, because I know some of you listen in rural markets, if there is a plan like that available in your market, it very well is a possibility that it's going to be what's known as a Medicare Advantage only plan. What a Medicare Advantage only plan is, it's a Medicare Advantage plan that does not include Part D prescription drug coverage, which means you pay all of your prescription copays, and well, not copays, they're not even copays. You pay 100% of your prescription drug costs all by yourself. You're on your own, which would be devastating for so many people. It's not worth $30 a month back to lose your drug coverage if you're taking a $500 a month or $600 a month insulin, right? Dumb. But that's what these call centers will try to sell you a lot of times. I've seen it happen a lot. It's scary. But be careful of that. Is it bad to get a Medicare Part B benefit? No, it's fine, but you shouldn't abandon your drug coverage to do it. You shouldn't abandon your network capabilities to do it, right? You shouldn't pigeonhole yourself into a situation to where you can see 5% of the available doctors and hospitals in your area just to get some money back in your Social Security check, just to get your Medicare Part B premium lowered by $40, $50 a month. You shouldn't do that. You shouldn't. It's dumb. Sorry. It is. It's not a good move. It's not a good decision, in my opinion. Now, if you can get your prescription needs met, your doctor's covered, good medical benefits, right? You don't want to pick a plan that has a huge max out of pocket. If you can get all the things that, in my opinion, are more important than that taken care of and your needs met, while at the same time getting $30, $40, $50 a month back in your Social Security check, then go for it. By all means, there's nothing wrong with it. It's not bad to do it. It's just you don't want to compromise the other areas of your plan to do it. And that's what a lot of people end up doing because they just don't understand Medicare Advantage plans. It's so much more than just getting your Medicare Part B premium lowered a little bit. There's networks involved of hospitals and doctors. There's medical benefits involved that will vary. There's prescription drug benefits that will vary. And some plans don't even have prescription drug benefits. And you need to have drug coverage, folks. You get a late enrollment penalty for every month you go without prescription drug coverage. And that penalty can last for the rest of your life. Wake up. Just because it says it on TV doesn't make it true, right? I mean, it might be a partial truth, but it's dramatically deceptive. And this is what you folks need to know about throughout this open enrollment period. Let me shift gears to this, though, folks. Can it be a good thing for people in certain scenarios to pick up a Medicare Advantage only plan and not have the prescription drug coverage? Yeah, there actually is some situations like that. If you have veterans benefits to where you get your prescriptions through the VA and you don't even need the drug coverage, that's a great situation for you. If you can get more of your Medicare Part B premium lowered, good other benefits, and cut out the drug coverage, that's going to work okay. If you have TRICARE for Life, I actually encourage you to cut out the drug coverage. That's going to be better for you because TRICARE for Life has very good drug coverage. And sometimes getting the Part D included just kind of mucks up everything, I've found. We've done complete episodes where we kind of break that down. If you have FEHB coverage, which stands for Federal Employee Retiree Health Benefits, that's probably a good idea to get an MA-only plan. So there's situations where it's okay to get an MA-only plan, but typically that's only going to be when you have another source of getting your prescriptions that's better, like the VA, like TRICARE for Life, something like that. That's really what those plans are made for. You'll notice that, there's certain plans that are endorsed by USAA, right? There's plans that are named after, certain American, terminologies. They're made for veterans. They're not made for the average person that doesn't have veterans benefits or anything like that just to pick up and not have drug coverage. That's not the intention of those plans. But they can be useful for the right person in the right situation. Anyway, folks, I just wanted to kind of address this, and it's an easy question to answer, so we're going to close this episode out. If you found this helpful, if it answered your question, leave us a 5-star review if you're listening to us on a platform that allows you to do so. Make sure to drop a like on this video if you're watching on YouTube. I would really much appreciate that. It helps with the YouTube algorithm. Subscribe, comment what you'd like to see us talk about on future videos. And if you need help with your Medicare, Christian Brindle Insurance Services is here. We're licensed in 43 states. We'd be happy to kind of help you if we can. Our office number is 801-255-5340, 801-255-5340. And until next time, folks, thanks for watching. See you next Monday. Happy Medicaring.